addressing the sinuses. What are our sinuses and why are they so important to us?
Sinuses are actually pockets of air, and we have a little model I think we'll get to show you a little bit later where we show you where the pockets are, but you have them behind your forehead, you have them behind your cheeks, and you have them between your eyes, kind of a little honeycomb appearance between your eyes. And if you drew a line straight through your nose, between your eyes, and straight through your ears, where those two lines cross in the center of the head, they're sinuses. What they do is, it's been debated for a long time. We think that they help lighten the head so that you can walk upright. That's one of the theories. But what we know they do, and what we're beginning to know even more recently that they do, is they're part of your immune system. And they secrete substances that help fight colds, help fight bacteria. And actually, even over the past 3 or 4 years, we're finding that they contain gases that probably help you breathe in and out and into your lungs.
So it's safe to say that they are essential to help us stay healthy.
They are essential to help us stay healthy.
Very interesting. Now, we're going to talk about the different types of sinus problems. Acute sinusitis, chronic sinusitis. Of course, we're in East Tennessee taping this, and it seems like our state, for some reason, suffers more sinus problems than people in other parts of the United States.
We are one of the highest. That's correct. There's several factors that play into it. One of the factors is genetics, because we do know that genetically people are predisposed to allergies, and if they're predisposed to allergies, that's one of the underlying causes of sinus disease. The other thing is we have a higher incidence probably of reflux, which also can contribute to sinus disease. And then finally, in East Tennessee, we have the greatest variety of flowering plants, grasses, weeds, and trees than any place in the nation except Hawaii. And so there's an awful lot of pollen that's out there contributing to this. And in East Tennessee, and particularly in the Knoxville area, we sit in a basin, so our air quality can decrease over occasion.
Very interesting. Now, what can we do when we're on the interstate and that big sign over the interstate says air quality poor today?
Call us.
Or
no, no. There's several things to do. One is to be aware of what's happening, because sinus and allergy disease is something that most patients will ignore because they're used to the sniffy running nose, they're used to having problems, and then they ignore it long enough, they begin to get chronic severe disease, and that's what brings you into the office for surgery and for other problems.
Very interesting. How many people in the United States actually suffer with sinus problems?
Everybody. No.
For your practice, you would.
Really. That's not exactly an exaggeration. At some point in time, probably everybody has some degree of sinus and allergy, even if it's just a cold. And that cold causes congestion, and you'll feel the pressure and pain. But by and large, I don't know the actual number of participants that are going to come in complaining of sinus disease.
What is considered to be acute or even short-term problems?
Right. An acute problem is a sinus infection that you have. Maybe you picked up a bacterial infection, or maybe you picked up a viral upper respiratory infection and you have congestion. We usually assume that if you've had it 4 weeks or less that it's an acute problem. It resolves, it goes away. Then we have, you mentioned chronic.
Right.
We have actually, sometimes we'll call one chronic acute, which means that you have an acute, you clear up, 3 or 4 weeks later it comes back. And so it looks like you're having an acute infection, but because you're having it repeatedly, it's really chronic. And then the actual term chronic means it's just there all the time. You never seem to get rid of it. You always have pressure headaches. You always have drainage and congestion.
So is there an average duration that someone suffers on the average?
It depends on the cause, but that's a very good question. It depends on the cause. If the cause is allergies, and let's say you're allergic to ragweed, well, ragweed will pollinate in the spring, and then it pollinates again in the fall. So starting in mid-August is about when we'll begin to see the ragweed level come up enough that patients begin to complain. And that will continue until we have the first killing frost. And once the first killing frost occurs, a lot of times we'll see their symptoms go away. Well, that's a chronic problem, but because it's partly allergy and partly sinus, it is directly related to the underlying pollen. Otherwise, some patients will have it usually 3 to 6 months, but we have patients that have it every day.
So this can be, I guess, a very expensive cost for Americans as
It
a
can be
whole.
extremely expensive. As you'll recall, before we started, we were discussing the numbers, and it's about $8 billion a year in healthcare costs for this, and 56,000 56 million work hours. So it is actually the #1 cause of loss of work time. You know, we think of back pain, we think of heart disease, we think of lungs, but actually sinus and allergies, the #1 cause in America of loss of work time.